What is Medicare and what is Medicaid? How are they different and how do they work together? Let's dive into it. We will start with a thing we are best at, Medicare. Medicare is a federal level health insurance program that offers insurance to adults over the age of 65 and people under 65 who qualify due to disability status. Original Medicare is Part A, which is hospital, and Part B, which is medical. Part A is free for most people, and Part B does charge a monthly premium. For simplicity's sake, we'll say that Medicare covers roughly 80% of your medical costs, and you are responsible for the other 20%. There are some copays and deductibles and other costs, but this is the biggest one. Original Medicare by itself also doesn't cover prescriptions, dental, vision, and hearing. In order to help you cover your 20% and get coverage for those other benefits, you can look into government-approved secondary insurance policies from private companies like Medicare supplements, Medicare prescription drug plans, and Medicare Advantage plans. While Medicare itself is for the most part the same across the country, the secondary plans available to you vary greatly depending on your location. Now let's talk Medicaid. Medicaid, on the other hand, is a federal and state level program designed to give health insurance to those on the lower end of the income spectrum. The standards for getting onto Medicaid vary greatly state to state. In general, your state will have an income limit that you must be below, and some states also have asset limits you must be below as well. Medicaid enrollees have one amazing benefit. Everything is free. I'm not joking. That's right, there is no monthly premium and there is no out-of-pocket costs on Medicaid. Medicaid can also cover benefits Medicare doesn't cover, such as dental, vision, hearing, and even things like long-term nursing homes. The trade-off is, outside of hospitals and emergency rooms, it may be hard to find doctors that take Medicaid. So while everything is covered and free, you may not be able to do much in the way of preventative care. Now let's talk about Medicare and Medicaid if you're using them separately. You may now be asking, what if I'm on both? Well, for starters, you can be on both. And you often can get Medicare secondary plans as well. This allows you to use either depending on the situation. You always just have to specify which one you are trying to use and make sure whatever healthcare provider you are trying to see accepts it. So for instance, maybe you go to the emergency room and you use your Medicaid, but if you want to see a local provider, you use a Medicare Advantage plan. Now we're going to answer the question, can I use Medicare and Medicaid together? Well, you can. So while you can use Medicare and Medicaid separate from each other, you can use both together and get some amazing benefits. There are special plans called dual eligible plans that are made for people on both Medicare and Medicaid. They are abbreviated as D-SNPs. Dual eligible plans are amazing for a few different reasons. The first is, just like Medicaid, there are no out-of-pocket costs. On top of that, you may even get a care coordinator to help manage your health care. You can also get a grocery allowance, expanded transportation benefits, over-the-counter benefits, and so much more. These plans are truly amazing if you qualify for them. The issue is, in some states, once you qualify for Medicare, it becomes harder to qualify for Medicaid. Here in New Jersey, for instance, the income threshold for Medicaid is roughly $16,000 for a single person, and it drops to roughly $12,000 once you qualify for Medicare over 65. Now, we hope this helps you better understand Medicaid, Medicare, and how they work together. We have helped thousands of people with their Medicaid and many with Medicaid as well, and we would love to help you. If you have any questions, feel free to visit our website at www.njlifeandhealth.com or call our Toms River, New Jersey office at 848-226-6897. And don't let the NJ in NJ Life and Health fool you. We are licensed in about 20 different states, so depending on your situation and location, chances are we can help you out. And if you're someone who just likes to, work on your own time and educate yourself, check out our YouTube channel. We have a ton of great educational content, and we'd love for you to check it out. Like, subscribe, and leave a comment below on the next video you would like to see. So thanks again. We'll see you in the next video.